Welcome to another episode of Easy Access to Healthcare for All, a program which brings you news and issues around the National Health Insurance Scheme as it drives Nigeria towards universal health coverage. A well-motivated workforce in the NHIS can help in no small measure to drive the scheme towards achieving its goals. No wonder then that the Professor Nasir Sambo-led administration saw the need to introduce a reward system that will enable the scheme reward staff for hard work and performance annually. How does this system work? What are the modalities? These are the issues we shall be discussing in today's episode of the program. Why don't you sit back as we unfold our package for you? I am Aisha Muhammad Ahmed, your regular anchor. I will be back shortly.
Easy access to quality healthcare for all. NHIS.
First on the program is a highlight of events around the NHIS. Top of our news story. NHIS sensitizes Nigerian Correctional Center staff in Kuje. These and other stories coming up shortly. Keep watching.
In line with its mandate of achieving universal health coverage by 2030 and the rebranding agenda of the present leadership of the scheme, the media unit of the NHIS paid a visit to the Nigerian Correctional Center, Kuje. The visit was to sensitize them on enrollee rights as well as to enlighten them on the new flagship program of the scheme, the Gift Ship. The team was led by Mr. Julius Franklin, Assistant General Manager, Media and Public Relations Unit. While speaking, Mr. Julius said the visit became necessary in order to help the scheme interact with enrollees, sensitize them on their rights, and enlighten them on gift ship.
Extra dependent. Now, federal government is paying for us as employees of the federal government, as civil servants. That payment covers us, our spouses, and 4 biological children that are less than 18 years. That's what federal government is paying for now. Let me say this, all over the world where there is social health insurance program, it is either somebody is paying for you or you pay yourself. It is not free. Federal government is paying for the civil servant, the spouse, and 4 biological children. But extra dependent has to do with your parents. You want to add your mother, you have to add your father, you want to add your in-law, your father-in-law, your mother-in-law. You pay a token. Because I've said that all over the world, health insurance is not free. That payment is 15,000 naira each of them, renewable every year.
After his presentation, there was room for questions and answers as staff of the Correctional Center needed clarification on matters bordering on the health insurance processes and at the point of accessing care.
Do I have the right to collect my money back from the hospital if they fail to give me drug and I have to go buy it outside?
HMO passes to hospital, so we don't even keep money. So there's no money anywhere for you to collect.
Is there a possibility I can add my wife, like after 2 or 3 weeks they'll add her to my scheme? Because the one I did somewhere, they said after 4 months, and up till now I'm still waiting.
When you register afresh, or you add somebody, or you change hospital, you wait for 90 days. It's a policy issue. It is for us to perfect all the administrative processes. So since you registered last year, if you come by April, sure, it will be there.
Very wonderful package.
Some staff of the Nigerian Correctional Service commended the NHIS for the initiative amongst other successes.
You people have enlightened us. What we are suffering, I would say, is because we are not enlightened. Now that we are enlightened, we can be able to ask for our rights. So now we have known our rights, I feel we will enjoy it more. We don't know most of the things you people let us understand today. Have come to our notice, so we will ask for them so that we will enjoy the national health as we suppose.
I really appreciate the fact that you people came to enlighten us more on how to go about the problem we are facing concerning these issues that are going on around. Most of us have faced through so many difficulties when being attended in the hospitals. But the way to go about it make us ignorance of our rights. But thank God for the enlightenment. At least by the next time somebody like me go and encounter any case, I know how to stand.
The giftship program is a very wonderful package, and it's coming on board. It's something that I think will really give everybody ample opportunity to expand their partnership with the NHIS. And just like you said, even parents, elderly people, and other dependents can as well benefit from this. So I think NHIS is trying to broaden the scope of their activities. It's a laudable program which I think they should encourage more on it.
Easy access to quality healthcare for all. NHIS.
Welcome back. Enrollees of the National Health Insurance Scheme have glowing testimonies of the scheme and how it has removed their worries over cost of care. But what about the staff of the NHIS who make things happen? Their contributions is being recognized as the new reforms in the scheme has seen to the introduction of a reward system in the NHIS. Let's learn more about the reward system in our next segment, Issues Around the NHIS. Please stay tuned.
Easy access to quality healthcare for all. NHIS.
The NHIS is the foremost agency in implementing social health insurance in Nigeria. It is intended to be the veritable vehicle through which Nigeria can attain universal health coverage. The new management of the NHIS, under the leadership of Professor Nasir Sambo, has not relented in its effort to take the scheme in a better position. One of such efforts is the introduction of the NHIS reward system. It is a new initiative used by the scheme to reward staff for hard work, diligence and integrity. Sani Garba is the General Manager, Human Resource Department, NHIS. He speaks more on the initiative.
The reward system of the National Health Insurance Scheme is a management innovative way of trying to see that within the generality of the workforce of the NHIS, there are people that are exceptional in terms of their conduct, attitude, behavior, and output of their work, which needed to be recognized, identified, and exposed and rewarded. That is why management thought of setting up a committee which was ad hoc at the initial stage, but later made a standing committee that will now be looking at the overall performance of staff, both at the headquarters, departments, units, and the state offices, to ensure that whoever that works and meets the target that has been set up for him in terms of his performance and output will be recognized and rewarded, so that it will serve as a basis for motivation to other staff to emulate and continue.
This initiative is a part of the new reforms of the present leadership of the scheme that will gear the members of staff to put in their best.
It is one of the deliverables and valuable components of one of the priority areas, organizational culture, that is expected to remodel the behavior and conduct of the staff from what they were before to a new thinking now, that yes, anything that the scheme does has a purpose, has a focus in terms of getting it better and adding to the overall general performance of the scheme in terms of achieving better results. We cannot even quantify this kind of negative consequences that has happened over the years. People don't value their work attitude, they don't value their attitude of coming to the office, and files, records, and reports that are supposed to have been given in record time have suffered lack of result and non-submission in respect of what is being expected by all and sundry. And that was why after the coming of this new management in 2019, and based on the need assessment that had been conducted, we realized that so many things that ought to have been achieved within record time have suffered a lot of lapses and a lot of inefficient delivery, which has culminated into what was transmitted or transformed into the low or abysmal performance of the scheme as a whole, which made the current management to look into these areas and say, let us know how to do things better, and introduce so many ways of doing things differently so that better result can be achieved in terms of getting to the attainment of the mandate of the scheme as a whole.
The reward system has some characteristics that represent the core ingredients of the initiative.
The core ingredients, of course, are conduct in the first place as a person in terms of punctuality of coming to the office, deliverance on what is expected to be performed based on each and every individual staff's performance schedules, and then of course other relationship matters that has to do with the internal relationship with your colleagues in the staff, your behavior and adherence to the basic rules and regulations that are governing public service procedures, and then of course the overall one of getting better results and better outcome for our enrollees, who are the basis of our existence and basis of the mandate that the scheme is trying to achieve towards the attainment of the universal health coverage.
There are 3 categories in the reward system: the overall performing staff at the department and unit level at the headquarters, overall best performing staff at the state level, and then the support staff at the 2 categories.
In each level you have 2 levels. That is, the officers on grade level 7 to grade level 14 are the ones to be assessed, and then there are secretaries and office assistants and drivers who are the support staff. And you know, in the conduct of the scheme's work and operations, certainly the support staff contribute greatly in the delivery of the service that we render to the various Nigerian populations that are enjoying the service of the scheme. So these categories are being assessed, and then based on the assessment, we now come to arrive at who is the best at the state or departmental level, and then in addition to this, then we will come and assess who is the overall best in the headquarters and who is the overall best at the state level.
This initiative is overseen and evaluated by a committee consisting of general managers of the various departments across the scheme. Mr. Sani tells us how they function.
The management committee has general manager human resources and other about 9 general managers in the various departments and units that have formed the main modus operandi and the guidelines and proceedings in terms of getting who gets this kind of reward system that we are talking about. But of course, we cannot work here and work at the state level. That was why the recommendation of the committee, which management has endorsed, is that in each department and in each unit and at the level of the state offices, a 3-man committee is saddled with that responsibility of looking at the various criteria and yardsticks that have been set aside for the attainment of this reward system, which comprises of 2 management staff, that is 2 head of departments and other management cadre in the rank of assistant general manager and above that are to be part of the main committee, and then 1 of the intermediate staff within the state office or the department to be part of those that will now review attendance, performance, delivery of work schedule according to records, and the other yardsticks that have been so identified and distributed and disseminated down to the participating states and the departments and units.
The NHIS has become a result-driven organization. It is the belief that this initiative will therefore boost the performance of staff towards achieving their goals while having the reward in mind.
Welcome back from that timeout. The present leadership of NHIS has introduced reforms that will hasten the achievement of universal coverage. One of it is the health insurance under one roof. It is an initiative that brings synergy into the health insurance ecosystem. In the light of that, we bring you an interview with Mohammed Safana, DG, Katsina State Contributory Agency, a partner in attaining universal health coverage. Mohammed Safana gives an insight on how the state healthcare agencies operates.
The National Health Insurance Scheme, when it started, it toured the whole country through the state legislative councils to ensure that laws are being created to establish such agencies based on their socio-economic and even differences that has to do with culture and other things like that. So that made Katsina State government to embrace and establish this agency. So after the establishment of the agency, the state government made sure that it brought all the inputs that is needed for us to effectively implement the scheme.
He gives an update on how the scheme has progressed. He tells us about actions taken to get the ball rolling.
Well, from the inception to date, we undergo a series of activities to ensure full implementation of the scheme. First of all, we started with what we call the baseline assessment survey, which made us to understand and the health conditions of Katsina State residents and the demographics. And surprisingly, we got to understand that about 35 to 45% of the civil servants in Katsina State, 35 to 45% of their salaries are being spent on healthcare. And that is what the United Nations calls catastrophic health expenditure. So in a view to reduce or to eliminate completely the out-of-pocket expenditure on healthcare, we sat with the major relevant stakeholders to determine the percentage contributions that will be due and sustainable for the agency to implement the formal sector program of the scheme.
Other steps include,
and we were able to set up a monitoring and evaluation framework, and at the same time quality assurance framework with a robust ICT platform. So we were able to enroll the beneficiaries within 3 months of the flag off of enrollment, after which we started accessing healthcare by the enrollees on the 1st of July 2021. So from then to now, we were able to record a lot of successes. First of all, we accredit about 156 healthcare facility, which was earlier accredited by the NHIS, which we started using them to give healthcare services to our targeted enrollees.
Mr. Safana gives an update on programs and persons covered under the Katsina State Health Insurance Agencies.
We have, first of all, we have different programs. We have the formal sector program, the one I've just told you, and we have the informal sector program, under which we have the intervention coming from the federal government, which is the Basic Healthcare Provision Fund. And we have the community-based health contributory schemes. We have the constituency project contributory schemes, though we have not started that, but the blueprint is there. We are about to start the implementation of such. So currently, we are embarking upon the enrollment of beneficiaries into the Basic Healthcare Provision Fund. Most of the states with the National Health Act that created the Basic Healthcare Provision Funds, we were qualified by having this agency to benefit from the Basic Healthcare Provision Fund. The 1% coming in from the federal government as a consolidated revenue to Katsina State, we were able to receive the first tranche of payments, which will target 53,000 enrollees, out of which we have already covered 67,000. And now we have another tranche coming in that may definitely cover up to 60,000 enrollees. So when you look at the healthcare delivery system in the state between the 1st July 2021 to date, honestly, it has really changed the narratives and the statistics of health care delivery in Katsina State.
He speaks further on efforts put in place to attain coverage.
Well, we have different targeting mechanisms. We have what we are targeting in Katsina is we are targeting the enrollees through the traditional institutions because we believe in our state. We respect our traditional institution and they have absolute control over their subjects. So the moment they mobilize them, they can always embrace and ensure that they are being enrolled. So we use the traditional institutions through the emirs, the district heads, the village heads, and the imams and the religious institutions.
How does the NHIS and the state health insurance collaborate? Safana speaks more on that.
Well, almost every activity that we undertake in the contributory agency is being supported by the National Health Insurance Scheme. That ranges from sensitization, advocacy, and even courtesy calls to the targeted beneficiaries, especially under the informal sector program. We work hand in hand together because we have this health insurance under one roof, and part of the agreements signed during the retreat was that we have to work hand in hand, we have to share things together, we have to share our data together, we have to work together to ensure that we achieve the presidential mandate of universal health coverage.
That was Muhammad Safana of the Katsina State Contributory Healthcare Scheme, speaking from his experience as a stakeholder in the attainment of universal health coverage. Up next, your questions answered.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question.
Definitely. Your children, once they are biological, it doesn't matter. I mean, we don't decide whether you are married or single. The basis is that you are actually a contributor under the health insurance system, and we can verify that the children that you are registering are your biological children, or whether biological or adopted, as long as we have proof that they are your children.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
I think I paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
And so, we draw the curtains on this week's episode of the program. We all have a responsibility in helping Nigeria attain universal health coverage by keying into the NHIS and letting more Nigerians know that they can enjoy social health insurance even if they are in the informal sector. Remember, it is health that is the real wealth and not pieces of gold and silver. See you next week.